You're listening to Expertly Said, a podcast on the art and impact of communication. I'm Kristen Sweeney, founder and CEO of Every Little Word. My guest today is Sara Noonan. Sara is a seasoned life sciences communications professional with nearly 2 decades of experience working in rare disease and oncology. She has held roles as the Senior Director of Product and Pipeline Communications for Servier Pharmaceuticals and spent nearly a decade as the Director of Public Relations and Investor Relations within the Oncology Business Unit at Takeda. Prior to her in-house positions, Sara spent several years at communication agencies supporting clients in pharma, biotech, and patient advocacy. She has deep expertise in communication strategy throughout a product's lifecycle, as well as corporate communications, thought leadership, and crisis communications. She's also been involved in the development of patient advocacy and ambassador programs in both rare disease and oncology. Sara is also one of my closest mom friends, which is to say one of my closest friends. Sara, welcome to the show.
Thanks for having me, Kristen.
I'm really excited to have this conversation with you and to have you here.
Me
Like to
too.
start with our guests talking a little bit more about, we've heard a little bit of the shape of your career journey, but
Mhm.
more about that origin story. Did you always know that you wanted to go into communications?
I had actually started out wanting to be a journalist, and I applied to Emerson College, which has a journalism program, as well as a marketing communications program. And sitting in the orientation, I ended up seeing both the journalist and the marketing presentations. And at the end of that, I switched my major and moved into marketing. I was so inspired by the way that you can change the way people perceive things through more outlets than just the written word, and that really spoke to me as a way to use my creativity from an art side as well as my love of words to be able to do something, as a career. And I didn't even really think about that at the time that I had applied. And so from there, I just, went switched my major and then have always been a lover of science, but I am deeply afraid of blood, which is just
Relatable.
where I'm at. So I didn't go the pre-med route, knowing that I would have to overcome that fear. And so I really took the time to think about how I could bring writing into science because to me, science was so exciting and I loved it so much from such an early age that I knew that that's where I wanted to go, but I didn't really know how I was going to get there.
Yeah. Yeah. I always got to shout out my friend Colette who like carried me in biology lab. I was a great student, but I just like sat back and took notes during all dissections.
I passed out when we dissected the fetal pig. So,
Oh,
I mean,
yeah, yeah,
I
yeah, yeah,
knew
yeah.
I knew at that moment that I was not going to be a doctor.
Yeah. Now, were you a writer as a kid? Was that something, it sounds like you kind of knew that that was something you were really interested in going into
I
college.
yeah, I really I think started to develop those skills in high school. I was really big into art. So I did a lot of painting. I actually had a lot of gallery shows around the Cape throughout high school. Um, and then I also really loved reading as a child. So I was the kid with the dinner book at the table, constantly being
Mhm.
told to keep putting it away. And then, I got to this point in high school, I think it was my junior year, and you could take a journalism course. And so I started writing articles for a school newspaper, and it was a lot more exciting than an essay on, a specific author or book we read. And
Yep.
I really, really loved it. And so I wanted to, make my career about writing. And I thought journalism was going to be the obvious choice. But of course, I think working on the public relations side, it's really just the other, flip of the coin, although journalists would probably not agree with me on that. But that being said, my love of writing was very clear. I mean, I was also the kid who used to like write her own stories. Sometimes I find them, I'm deeply embarrassed and want to burn them, but I'll keep them for my kids when they're older. Um, and I just really cared about how you could present something to people, that was going to grasp their attention. I didn't want to be an author. Um, I liked short form. I felt like that was a lot more impactful and meaningful for me. And so, once I started to learn what my job could be like, I, very quickly gravitated to that field.
Yeah, I do. I mean, I was the same kid. Like, ask me about how I have long arms and I used to read in the shower. Like, I, but like, I think that for so many folks in communications, it is reading that is often that spark because you've been impacted by something.
Yeah.
You have sobbed in your guest room finishing Charlotte's Web or whatever else. And I know that, like, the kind of work we do now maybe doesn't always carry that same impact, but
Yeah.
for me, I feel that, like, the impact of words, the influence on of language and its ability to get me to, like, feel something or influence me or really change
Yeah.
my mind, um, is, like, definitely a driver for me as well.
Yeah.
So then we already went into some agency background. So tell us
Yep.
a little bit about that, because it sounds like that's where kind of life sciences specifically came into
Yep.
play. And then I'd love to also dig into the transition, that
Mhm.
decision to go in-house and kind of differences at the time, but we'll get there.
Yes, awesome. Okay, so, back to college, I was at, like, the career counselor's office, and we were talking about what I wanted to do, and I had actually just done a project with one of my professors where we were working with, Boston Children's Hospital to, bring in volunteers to help cook for families that were staying in one of their homes for, people who don't have enough finances to stay in, like, a hotel. So they bring in these families, especially for some of the bigger operations that their children need to go through, and they're generally not from the area. So we were working on a program where we were bringing in, um, other professionals, but also people from the hospital to come in and cook them, like, a home cooked meal in their kitchen.
Mhm.
And I was talking with some of the, hospital staffers about, my love of science, and I was a student, and I remember, um, this woman had looked at me and she goes, "Go to agency and learn as much as you can, and then think about coming in-house," whether that was, hospital or pharma company, and so I went to my career counselor with sort of that in mind, and I said, "I really wanna work for an agency, but I really want to be doing it in healthcare." And she just so happened to receive a job description that day for a
Wow.
student internship, for Wagner Edstrom for their healthcare team, and I applied, and I got the internship. I remember actually getting the acceptance, and there was a bee trapped in my dorm room.
Ah, my worst nightmare.
Well, I was, like, trying to dodge the bee that was flying around, but I was so excited that I was gonna start my career, and so, I went in, I think I was, like, one of 10 people. We had a couple people in Boston, a couple people on the West Coast, and a couple people in London, and, I started working for primarily rare disease and cancer clients, and I loved it. It was suddenly that opportunity that I had been looking for to write, for a living, but also get to explore science and explore how drugs worked and diseases worked and understanding the competitive landscape and how all of this sort of fits into this big pharma world. And I I just loved it so much. And so I, continued down that track. I actually left after 4 years there to go in-house for one of our clients, who was a startup making metabolic nutrition, um, supplements and
Mhm.
formulas for patients with PKU, which was a rare disease that I had also worked on a drug for. And, um, that was really exciting and inspiring, but I felt like my time wasn't totally done with an agency. So I had come back, and worked for an agency which has now been acquired by Ogilvy for a couple of years where I continued down that track. But the nice thing about this experience was that now it wasn't just sort of straight like public relations and communications. At this agency, I really got experience on launching companies. For example, like Moderna was one of our companies when they were
Nice.
coming out of, um, that period of venture capitalist investment, and we're going out in the world. And it was really exciting to see how you basically created a pharmaceutical company from the ground up. So then I was working on websites and working with creative directors on what is their color schematic and how do we want people to think and feel when they see images, that relate back to this company. And I was just, having the time of my life. I think there's also something to say when you're young and working at a communications agency, you have really good friends around you because you guys are all in it together and
Mhm.
you're all doing your early mornings and late nights together and you're spending a lot of time with one another. And so you feel really supported and excited to get through this. And you learn so much because you have so many different clients and so many different types of projects that it's just this like continual fast paced momentum that's going through. But there gets to a point in your agency career, so if we wanna flip to sort of the, like, going from agency
Yeah.
to in-house, where either you can continue on the agency track and you can go and be, you know, a more senior professional within the agency, and that requires new business and trying to find new clients, or you make the switch to go in-house, whether that's, and in my world, a pharmaceutical or a biotech company, a venture capitalist, maybe you go into academia or you go into a hospital system, but there's this point where you kinda have to pick the track that you wanna go into, and I personally wanted to keep doing the work. I didn't necessarily want to try and find new business or start to be more in a management position. I really wanted to be ingrained in that. And so, I moved over to Baxalta, which was a recent spinoff of, Baxter, and their R&D and oncology teams were based in Boston. It was, funny enough, was just across the street from the agency I worked in, so
That's
I could, like, walk across and have my interview and then come back, just like I had, gone to lunch or something. So, we always joke in this, Boston area that, you can go to a different company, but you don't change your parking space, because everyone's together, right?
Yeah,
So
yeah, yeah.
I went over to, Baxalta, and not even a year into, my tenure there, they were acquired, by Shire, and my job was going to change. And so, at that point, I started to network and ended up at Takeda working in their oncology business unit for almost a decade. And that place will forever hold a lot of meaning in my heart. I met so
Yeah.
many amazing people, patients, the experiences I was able um, to endure and just having this opportunity to really feel like I was making a difference in people living with cancer's lives. It was transformative and it felt like, I was waking up really excited to do what I wanted to do through written word, through video, through, social media and, running the gamut. It's expanded so much now, but, I was really
Yeah,
able
yeah.
to not just pitch a story to a newspaper. Like, we had the opportunity to control the story and also help share and educate around science and the way that our drugs worked and could potentially change lives. And so that for me was really exciting. And really, I think the number of years I stayed there speaks volumes on,
Yeah.
the meaning that the work brought to me.
Yeah, I love that. There's something you said early on, um, it was about learning, right? And, like, just learning how drugs work, learning how diseases work, and it's interesting because I think so often we end up kind of as a default assumption that that is an obstacle, like this, like, I've got to get up to speed. I've got to learn. This is
Mhm.
the blocker between what the scientist knows and what I need to do. And, the learning is this kind of challenge to overcome. One of our core values is hungry to learn. And, like, the
Mhm.
truth is, this maybe is not an exciting part of the sales pitch that's like, I love to learn. Like, I love that. But I think as
Yeah.
there is room for that, whether that's as an agency owner, as an individual inside an organization to say like, but this is really fulfilling for me to get to have new experiences and challenge myself.
Yeah.
And it's just, I liked the way you framed it because I think so often the sort of like cold hard business case is like, well, it
Yeah.
shouldn't be hard for somebody. It should be easy because then it will be efficient. And like, but
Mhm.
that's different. And, we're millennials, so we want things to be fulfilling. So,
Amen.
yeah, yeah, I love that. And I like what you shared about like that, seeing the fork in the road. I can certainly say that like getting new business is not for everybody and it is not always that fun. And so
Mhm.
like it sounds like you're very, very clear eyed about those pathways. Um, I know that patients are really important to you. And of course, like to a person, when we work with folks in pharma and talk to them, like patients are at the center, right?
Yeah.
And most organizations, there's a mission that is very focused on that and with good
Yeah.
reason. Um, but you've had some examples where we're going to talk about some of your personal experiences a little bit later on,
Mhm.
but you've had some examples where you've really tried to look at what patients need and maybe kind of push the envelope a little bit in an industry that's known
Mhm.
for being very risk averse and with good
Mhm.
reason around ways to reach patients, different kinds of campaigns. Can you share a couple of those examples and yeah, I'll have some follow-ups.
Yeah. Yeah. So, I think, as you said, patients were very important to me. And for me, the patient was the reason that I came to work every day. And I think that, you know, you hear from pharma a lot, like patients are at the center of, everything we do. It's certainly, the mantra and everywhere I've worked, but it really is true. And it's not just sort of like the saying. I mean, we deeply care about the people that we're hopefully going to make an impact on. And we're also in an industry that is extremely regulated for good reason. And it's really important to understand those regulations, but then understand how you can deliver information and education to people, you know, even though there are some barriers that might, be in the way to get there. Um, I think, you heard me speak at the Fears conference this past fall with a legal counterpart. And, for me, I think that's also, I'll say out of the gamut, is so important for any campaign is to have that legal buy-in, the regulatory buy-in, the compliance buy-in, and the relationships that you build with those teams is so critical. Another big difference too in terms of agency life, it's a lot harder to form those relationships when you're not in-house. And so being in-house allows you to do that. So I can bring forward maybe two examples, one from my agency days and then one from my time in-house. But when I was brand new to the business, and Facebook was still just a couple years old, I had worked with a pharmaceutical company where we launched a Facebook community page for rare disease, and it was one of the first pharma-run Facebook pages ever. We didn't talk about our drug, and that was very purposeful. What we wanted to do was to be able to bring the community together and allow them to have conversations with one another and feel supported by one another in a way that they might not be getting before. I think now when you think about, a Facebook patient group, there's probably millions of them that
Yeah.
exist now.
Yeah.
But that wasn't always the case. And, we created this page in this community and we did it as, just for the awareness month. Um, we worked very closely with our legal counterparts. I was at an agency at this time, so I worked closely with my in-house counterpart
Mhm.
to work with her legal team and really help devise, the right rules and regulations. And we ended up winning a lot of awards for this work because we came about it in a very thoughtful, pragmatic way where we set this up for the patients, for their community, and not as a way to sell a drug. And I think that, when you start to look at communications and our role within a pharma company, it's not I like to joke and say that we're Switzerland, like, we need to be neutral. There's times where I'm gonna be communicating about a drug, whether it's data or an approval or, there's follow-on indications or just something that, is backed up by, research or a news milestone. But there's also the need to be able to provide education to the patients that are living with a disease on, you know, things that they should know about. And I think that this Facebook example is, today feels very elementary, but it was something that was really needed at the time.
Yeah.
You know, flash forward and some of the work that I've done in-house, I think has been more impactful, but maybe that's because the technology has grown and my ability to do more being in-house, um, was definitely a factor in that. And so, one of the things that I had done was work very closely with my patient advocacy team on a campaign to help support patients living with colorectal cancer. And this wasn't necessarily a campaign to promote a new drug that we had just launched, but it was a campaign meant to provide education to this patient community and let them know that we were here and supporting them. And whether or not you took our drug, like, for us, we wanted to make sure that you had what you needed in order to get the most out of your healthcare. And so that was, that work was incredibly meaningful to me because, one, I was able to partner with several other stakeholders within my company, patient advocacy being a very important stakeholder in that relationship. But I was able to work with marketing, with medical, with legal, regulatory compliance, with our R&D folks. And we really talked about what are the things that patients need. And we also brought in patients. So we also brought in advocacy organizations and patients to share what they're seeing. We disseminated a survey to understand an even wider net of what we were seeing after we had started to get an inkling. And we were able to really start to dig into how race plays a factor in medical care, how conversations with physicians might not always be the most productive, and how we could help change that. And to bring to light that, you know, there's going to be resources that we could develop, but they were very thoughtfully pulled together with a lot of research backing it and patient input so that we weren't just sort of, throwing spaghetti at the wall and hoping something would stick. We were really, really intentional. And that costs time and it costs money, resources, people. But, when you work for a company that's dedicated to the patients, that they serve, that's worth it because at the end of the day, yes, you're a pharmaceutical company, you're a business, but also you have the absolute privilege to be able to play a role in somebody's life like this and to be able to provide them with something that maybe they can use is it's an incredible feeling to be able to deliver on that. And I think that for me, you know, that was like my drive, my what, like why I wanted to do this. And then I know you've alluded to my own personal reflections and like that for me has made such an impact on just how I've even conducted my own, personal health choices and vice versa.
Yeah. It's fun. You were talking about the resources, and um, I worked for years. I was on part of the team that launched a new website for a breast reconstruction center as part of Northwell Health. And I mean, I was in it to win it with that team, like from day one. And I
Mhm.
remember, though, specifically this, because I would help with some of the like content mapping and organization as well as the copywriting. And there was a resource that was like a drain. It was to measure the output of your drains after
Mhm.
your surgery. But the the person who helped create it was like, all these other resources aren't that useful. This is actually what people need to measure and how they need to measure it. And I remember I
Yep.
was able to like at some point print it off and share it with someone in my life who was having a procedure, and they were like, this was really
Mhm.
useful. And I mean, so just those
Yeah.
things that are considered in terms of like the way people will really use them, and you never know what small thing you can do to like ease
Mhm.
somebody's path in the middle of their recovery or as they're going through
Mhm.
treatment. um and it's this is the other thing, and like I know there are, obviously we know there's like a lot of criticism of pharma, and it's been interesting for me over the last several years to really unpack and understand more about the business model and what's happening, but as how things like drug prices are set, right? And we don't need to like get into that here.
Mhm.
But one of the things I do think about often is I watch and observe the investment in things that aren't transactional, that aren't
Mhm.
tied. And as you said, that costs money to go build patient relationships. And yes, like there's also a business case for those things in a much broader, more
Yeah.
vague. It can't be, exactly tied to prescriptions kind of sense.
Mhm.
But there is in fact a tremendous amount of what I see of effort, investment, care put into things that are not transactional
Mhm.
as a big part of the conversation, especially of course like on the comm side and on patient advocacy.
Mhm.
Um so I want to transition now because we've been kind of talking around the fact that um our one big idea today is to talk about your own experience as a rare disease patient and a little bit about what that journey's been like and maybe how it's changed your approach to your work or how you think about
Mhm.
communication and patient relationships. So I want to give you a little bit
Yeah.
of an open floor to share what you'd like to share, and then we
Yeah.
can go from there.
Yeah. I think, what I have experienced in the last couple of years has brought a lot of aha moments to me. So, I wish I had a name for my disease. I don't have one yet. And I think that's also part of the rare disease journey is that it can take 5, 10 years to get a diagnosis. But whatever impacts me impacts my lungs. And so I think that you know, it's been a big experience for me to be on the patient side. So there's been some things that have fundamentally changed the way that I worked or brought perspective into patient communications and being able to think about that. One example that I can share off the bat is that I started seeing some like world renowned specialists, them being stumped on what's going on with me to um, to the work that I have bringing. So even though, my area is gonna be pulmonary, some of the work that I did in cancer, I still feel like there is a lot of crossover, especially because almost all of the diseases I've worked in my career have been rare, whether they were rare types of cancer or rare genetic disorders. And there was a doctor who sent me, like, a My Health message about a week before an appointment and said, "Can you let me know the top 3 things that you absolutely wanna make sure we cover when we see each other next week?" And I've never had a healthcare professional do that, and I don't think you're gonna necessarily see that, with a PCP, although I do recommend it. It's a great idea to
Yeah.
have your top 3, but, when we were thinking about programs for our colorectal, cancer journey, we brought that in of, let's make sure that patients know, you know, that they should think about the top 3 things that they wanna bring in, and if the healthcare provider doesn't necessarily spark that ahead of time, they should feel empowered and advocated to either share it ahead of time or bring the list in. But I think sharing it ahead of time also puts you and your physician on the same page. And for taboo topics, that's really a safe way to start to broach that because it kind of breaks down that barrier of this feels awkward to talk about. I think the other things though that I've experienced is just sort of the frustration of not knowing what's going on, the frustration of um, you know, feeling like I'm just going to appointment after appointment after appointment. And, I feel, we'll say, okay, I'm stable, but I don't feel great because my new okay or stable is a new baseline. And so, really starting to think about, how the patients that I'm working with in my role as a communicator, it was very eye opening to think about okay, when they talk about fatigue, this isn't just I got a bad night of sleep. This is I wake up every single day, even if I've gotten 12 hours of sleep and I don't feel rested. And I suddenly understood that. Or, I'm really sick and tired of getting all these blood draws. And I wish that I could just like skip this, this week or this month's, infusion or testing or whatever it is. And like, I suddenly got that. Like, it suddenly feels like you become almost like a lab rat, or you're like stuck in this cycle of like appointments and people maybe not believing you and then finally believing you because something got serious enough, or you know when you're talking about yourself, just talking about yourself as, oh, I'm doing okay, that doesn't spark a physician to think I need to make a
Yeah.
change for this person. They think, oh, they're good, they're doing well. My okay is different than your okay. And so it really started to help me understand the need to, one, advocate for telling people how a disease impacts your life, but also understanding how treatments work, how they're going to help you. How do you describe a treatment to others? I feel, you know, as a pharmaceutical professional, I didn't get to go and peek into those Facebook groups where they might be talking about our drugs or not. But as a patient, joining some of those,
Mhm.
patient support groups, you're suddenly seeing this world of, wow, there's a lot of people here who don't even understand their disease or the drugs that they're being prescribed. And you're seeing people say things like, I don't really know if I want to take that. I just have a mild version. And I'm over here, I just can't drop my communicator background, even though I'm not
Yeah.
working for some of these companies. And I'm like, yes, but if you look at the data, you know, it actually shows that it helps prevent additional lung damage. And we should think about, the importance of that and talking to our
Yeah.
physicians of, is this right for me to be able to help with this area, maybe not necessarily this area in which the drug is currently being advertised for. But then when I look at the data, I also really want to understand this area. And I think that like the average person doesn't have that baseline. And so, when you work in pharma, you know that people don't necessarily have the same, like, they don't have the same understanding of how drugs work or things work, in the body. But now that I am the patient and I'm seeing it firsthand, it's so clear that there's a lot of education that I think still needs to be done on how does this drug work? What does it do? What is the, MOA for the fourth grade reading level, which I think sometimes can be very hard on the pharma end to create because
Yeah.
it's complicated. But it's like, how can you describe this in a way that's really going to help someone? Because if I'm making choices about my healthcare, I want to know, what is this going to do for me? How is this going to impact my quality of life? I don't look at procedures or drugs anymore as, oh, this is going to be super helpful and like it's going to, it could potentially change your life and do X, Y, and Z. I look at it as like, for what are my trade-offs? What do I have
Yeah.
to take on, whether it's a side effect or, you know, a time commitment, and what am I going to get out of it? Am I going to get a better night of sleep? Am I going to prevent, for myself personally, am I going to prevent lung damage? For somebody who's living with cancer, is it going to help me live longer feeling this okay so that I can enjoy my time with my family and friends that I have left here on this earth? Or is it going to just, am I going to have tons of diarrhea and headaches and insomnia
Yeah.
that weren't really explained as a side effect that are going to make, the choice to take it maybe not worthwhile to me? And I think that there's this balance of trying to explain the worth of a drug and the worth of the treatment choice to patients that's not being done at the level that it could be to really help them understand, what's in it for them. Like, they want to know from other people what their experience has been like. And I think, again, the regulation makes it really hard for pharma to do this. But hearing firsthand from people who are on, these new prescription drugs makes a world of a difference. And before I started a new drug recently, I started looking in the Reddit groups and looking at the Facebook groups and understanding what people's experiences were with them so that, even though I think the choice for me came down to data and discussion with my physician, I also had maybe better questions to ask to
Yeah.
my physician because I had, sat down and looked and I said, "Oh, what time of day should I take this? How hard is it to get insurance prior authorization? What pharmacies are fulfilling this? Is this something I can go down to Walgreens or CVS, or is this something that has to come like a mail order?" And really starting to better understand that approach. I think that there's a lot of things that we can do in communications to help people living with diseases understand what the experience might be like. And I'm currently on leave right now because my condition has prevented me from being able to do the full-time job and be a mom and deal with my health, um, and that even that has been eye-opening of, I need to dedicate 20 to 25 hours a week to my health, to treatments and appointments and, making sure that I can stay stable so that I can live the other parts of my life. And I think that these are things that are not necessarily factored in when you are a professional, with a certain amount of money in your budget, knowing that you need to communicate certain things out and you've got, KPIs to hit and, marketing wants to see an ROI and, you know, other types of management wanna see, like, the return on the sales, and, like, there's a lot of things that factor in it, but I think if we can take a step back and make sure that the patient perspective is really understood and what they're looking for, I there's gonna be a lot of value if we can figure out how to do that in a compliant manner.
Yeah, I mean, gosh, so much there. So first, thank you for your transparency and your openness and generosity in sharing your story. Um, I think that, you know, when we talk about, to me, this comes back to empathy and really being able to put yourself in that situation of somebody else. And it's
Mhm.
not that easy. And it's also not just an exercise of imagination, right?
No.
Because you can try, but you can't fully imagine that, and maybe never can have
Yeah.
that experience unless you are, in fact, living it,
Yeah.
but, like, talking to patients, really hearing from them the ways in which every facet of their lives maybe is impacted and touched, and then, of
Mhm.
course, you have to make decisions about which things you feel where you can make the impact, and maybe you can't make that impact everywhere, and that has to be okay,
Mhm.
and you have to prioritize. Um, so as a child of 2 pharmacists, like, I was kind of, like, grinning to myself when you were talking about, I mean, we are, like, all over, "What are you taking? What is it? How often?" We're
Mhm.
just, like, very
Yeah.
nosy about that with each other within my family, so but the other thing is that I'm thinking, you know it's also not necessarily more is better, right? Because, like, you could
Mhm.
potentially overwhelm people, or maybe they're trying to get this information, but the 15 minutes they get with their physician and it's all kind of hitting them isn't enough for them to process it. And so
Yeah.
it's like, how do you maybe have that information available or serve to them when they're ready to consume it, where they're ready to consume it, kind
Yep.
of letting them lean into that phased education. Um, but the like, I think there's a little bit, maybe what you're describing is that curse of knowledge, right? Like, not understanding that the starting point should be not at G, but at A, right? Like,
Mhm.
all the way
Yeah.
back at A,
Yeah.
because for whatever reason, less exposure to this, like, maybe not having taken a lot of medications in their family historically or in their own personal lives, um, being very new, difficult to process, like all of those things that really bringing it back to foundations.
Yeah.
Yeah, it's really interesting. I'm I'm curious how with being on leave and like really prioritizing your health and seriously like massive that's a massive achievement, I think, in a world where so many people are like,
Yeah.
my health. And it's like,
Yeah.
that just feels like the thing that you will just try to squeeze in around everything else. And you are this example of like, maybe as the result of a forcing function, but still like choosing to pause. Um, how has that, like, if at all, sort of impacted your sort of professional sense of self? It sounds like this is the first time you've not been working
Oof.
full time since
Mhm.
you graduated.
Yeah, that's very true. I let's see, I have been off of work for almost 6 months. It's about the same amount of time I was off when I had my second child for mat leave, although
That
let's
felt
be
like
real.
work.
That was worse than work. Um, jokes aside, I think for me, it just kind of came to a head of I was just so sick all the time, and, you know, it was I think the decision was I actually had just come to see, you and your
Yeah.
family for a visit, and, I had been sick for, like, 3 weeks at that point, and I was, with what we call a flare, uh, but I wasn't thinking of it in those terms then, and I got home and I still wasn't better, and I still wasn't better, and I still felt worse, and I even started antibiotics, and I just got to this point where I was like, "I can't keep doing this," and I started to really seriously think about it, and I was like, "Okay." I took this day where I was like, "If I stopped working, can we afford it?" Because that wasn't even really something I was like, "No, we can't afford it if I stop working." But I was like, "No, no, no. I can't work myself into the ground," because at the end of the day, I had 3 jobs, and I was like, "I have my full-time work, I have motherhood, which is definitely more than a full-time job. Even when your kids are at school for the day, it's absolutely
Yeah.
something that's still always there. And then I have my health. And as I said, like it's 20, 25 hours. I only know that now because I'm not working, but I was fitting in 20 to 25 hours of health related issues into a 40 plus hour work week on top of being a mom. And I started to think about what was the most important thing for me. And I had to really separate myself from this idea that my career defined me because I think as millennials, as women, we grew up thinking that the work that we did is our entire, you know, personality. It's who we are. And I just got to this point where I was like, I can't even like no pun intended for being a pulmonary patient, but I can't even breathe. Like, I literally can't even breathe. How am I going to be able to take care of all of these things? And you know, I started as like, let's go on short term disability and just take a step back. Let's get over this flare that I'm having. Me being sick can take up to 8 weeks before I recover. I used to work through those. It was really hard. I had, you know, gangrene in my lungs and went back to work 4 weeks afterwards. And like, I think that my drive to be a professional was really clouding my vision as a patient and a mom. And I knew at the end of the day, if I had to pick out of the three, I knew that I had to pick myself and I had to pick my kids. And it was really hard. I will say I have tried to keep my, foot in the door to try and maintain a lot of, you know, my knowledge in the space and continuing to ensure that I can, you know, stay involved in whatever capacity I can because I truly loved my career. I loved it. And it wasn't a job, it was a career. I
Yeah.
loved the work I did. I loved being able to make a difference in people's lives. I loved working, you know, with, teams of really smart people. I loved managing. I loved being a mentor. But I also knew that I couldn't show up 100% in that capacity if my health was completely failing, and I was just sort of, like, throwing it to the wayside. This is not this is no longer the dentist appointment that I need to schedule,
Yeah.
because that's overdue, right? It was like, I literally have lung damage that I, cannot reverse, and it's hard to breathe, and I need to be able to put everything in it so that I don't get worse and that I can be here to watch my kids grow up and I can be their mom who's not running on fumes. As I get emotional,
Yeah.
I want to be the best person I can. And it took a lot of work. I cannot say that that was an easy decision, but it was something that I was able to, um, you know, I talked to my therapist about, I talked to my friends about, my family members. I have such an amazing network of people in my life where they were checking in on me and making sure that I was, holding up mentally. But, I knew that at the end of the day, my identity couldn't be defined by my professional life, but it needed to be defined by the things that I did for myself. And I also needed to show not just my kids, but I think like the broader community that it's okay to put the pause button and put yourself first so that you don't end up in the hospital again, you know, or dead, right? Like, I know that that's very morbid, but it's so important to take care of you so that you can take care of others. And especially when you have kids, like, there's no one that matters more than them.
Yeah. Yeah. I get that. I definitely get that, listeners will learn now that our oldest kids are about a week apart. And so we have walked that journey together every step of the way along with a
Mhm.
great group of moms. Um, I really love what you said about that because this this show is about like many of the folks on it's about communication, but many of the folks on
Yeah.
here are communications professionals. That's the context in which we come on this show. Um, but at the end of the day, we're people and we bring our own abilities and biases and beliefs and
Mhm.
perspectives, all of that into the mix. And um, I really resonate with what you said about not just for your kids, but the community. And I think about industry as well of showing like almost being this in the way in which you want patients to be taken care of,
Yeah.
taking that step for yourself.
Yeah. Yeah.
Yeah.
I have to show up for myself as I would want or had told people to show up for
Show up for
themselves.
themselves. Yeah.
And, I really it it took me a good, I'll say, like, maybe 3 years to get to that point, but,
Yeah.
um, I hope that even that step has made an impact on someone's life. And, I've shared it on LinkedIn, which again, that felt very taboo and weird to me at first, but,
Yeah.
my husband encouraged me. He was like, "You should share, what you've been going through because I think that people would learn something from this experience." And, and it's true. I think that when you see what others are doing, our personalities, our personas on social media, LinkedIn included, can be very, defined. And we don't really go outside of those boundaries. I was the go-getter. I was the, dedicated, loyal employee. I did everything I could to make a difference. And and then being able to share something so vulnerable but I also had to step back. I might have been those things and I still can be, but instead of being a go-getter at work, I'm a go-getter for my health. I'm going to my doctors and advocating for myself now. I go into appointments with my spreadsheet of here's all the things I've experienced since we last saw each other. Here's all the meds I'm on. Here's the side effects. Here's the experiences I'm having with insurance. This is what I want to talk about. And like I'm able to do that for myself. I also noted a shift in the way that my doctors worked with me when I stopped just coming in and telling them that I was doing okay and, I was tired, but, I was just getting through it day by day. When I took the moment to say, I need help, I had to stop working because I don't feel well and I feel awful every single day. They jumped into action. Imagine if I said that 2 years ago, what my life could have been like, what therapies I could have tried, what experiences I might have gone through if I had just done that 2 years ago. But it took such a big action for me to do that and say that. And if I could tell any patient like out there now, it would just be go tell them how this impacts your life today. Just tell them how much, you're not sleeping or you are sleeping, how much, you know, your drugs are making an impact on your ability to do XYZ. Like there's so much here that we can do together if we're just upfront with one another about it and we let them know my quality of life is not what it was before and I no longer like it. Like it's okay to say those words. And I think we don't want to burden our doctors sometimes. Go burden your doctors. Go tell them what's going on.
Yeah.
They want to help you. They want you to feel better. And if they don't know how bad it is, they can't do it.
Yeah. And we'll all be patients, right? We may not all have a rare disease diagnosis, but we will all be or have been in that
Hmm.
situation. I have a physician right now, it's an allergist, and she is that person independently. She's
Hmm.
like, "I wanna do this and this and this, and I wanna try this and this,"
Yeah.
because I came in and I was like, "I have horrible allergies," and she didn't write it off, and she wasn't like, "That's the
Yeah.
best it's gonna be for you." She was like, "I'm making these 7 changes
Yes.
and," um,
Exactly.
but to your point, you're also dealing with individual personalities and constraints and things. And so being that advocate
Yeah.
for yourself and being able to say,
Yeah.
here's what it is, that doesn't mean it's a magic pill to fix all of those
No.
things, but
But
you also don't know what connections they might be able to make or
yeah,
small adjustments that might be able to change
I
things.
know. Exactly.
This has been a really, really powerful conversation. So thank you. I want to thank you before we move into our lightning round section, something a little bit on the lighter side. But I really appreciate it, Sarah.
No, it's been great.
All right. So we're going to
Ready.
transition now to the last word. This is our lightning round section. Every guest here gets the same 5 questions to answer. So just go with your gut on these. Are you
Okay.
ready?
I'm ready.
Question 1. What is your favorite word to say out loud?
Okay. I asked my husband because I was like, which word do I just say all the time? And he said, James. And so
How sweet.
jokes aside, I was thinking about it though. And I think, one thing, maybe not out loud, but sort of my mantra has been breathe. I think about it in yoga. I think about it during stressful situations. I think about it literally because,
Yeah.
I'm dealing with lung issues and, breath and oxygen are just so important. And so it's been sort of my like internal monologue. And I was like, you know what? This is going to be my outer monologue now. I'm going to say it more often.
Yeah, I love that. What's a word you know from reading, but you maybe don't want to say it out loud because you're not sure how to pronounce it?
Okay. I'm not going to give you an exact word, but this was inspired by your oldest. There was a book at your house that I tried to read her once.
Oh, no.
And it was P is for pterodactyl, the worst alphabet book ever. I will tell you that I hated that book so much that I would not finish it, and I put it down because there are so many words in there that made my brain just spin, that entire book.
Yes, yes, I love that. That's excellent. How about a phrase or saying you wish could be retired for good?
Pressure test.
Why?
It just gets said too often.
Okay, great, great.
It's one of the things where I'm like, "Oh, no, don't say that. Stop."
What's a communication principle or practice you're willing to plant your flag on?
Oh my god, I'm really old school. I love AP style, but maybe AP style from, like, 2008, so maybe it has changed, but I don't use the Oxford comma.
Okay, we'll talk later.
I'm sorry. It's been ingrained in me. I can't use it.
Yeah.
It's so hard. Sometimes I know I need to, but
I am a lover of the Oxford comma. I, for too long, from working in a law office, though, did two spaces after a period. And I mean, it was years
mm,
before I finally gave that up.
yeah,
So I get it.
you know,
Hold on.
I get it.
Hold on.
I will hold it forever.
And what's the last thing you read, heard, or watched that really stuck with you?
So I have been doing a ton of reading, as I've shared. I'm a big reader. But I just finished this book called Tress of the Emerald Sea. And it was so, like, whimsical and transportive. Like, I just love the type of storytelling where you feel like you're there, and that's what that book did for me. Not every book is gonna do that, and so when you get one that really does that, I was just, like, over the moon with it. Now I'm recommending it to everyone, so I was like,
Okay.
what better way to do it than say it on a podcast? So,
Amazing. Amazing. Yes. And
Tress
we
of the
always do
Emerald Sea.
a wrap up of these after every season, too, where we publish all of these recommendations in particular. So I'm just going to get some.
Amazing,
Yeah.
amazing.
Sarah, thank you so much for joining us today. Before I let you go, if our listeners want to find you, what's a place where they can connect with you?
So they can certainly find me on LinkedIn. Or if you're interested in my artwork, I recently launched an Instagram where I've been posting my watercolors. And that is Sara Noonan Art. No age.
And Sarah is a very talented artist. She's drawn some wonderful things for my kids. Awesome. Sarah, thank you so much. Really, it was wonderful having you today.
Thanks, Kristen. I was glad to be here.
That's it for this episode of Expertly Said, produced by Every Little Word. If you liked what you heard, please support us by subscribing, sharing the episode with a colleague, or leaving a review. If you want to connect, you can find me on LinkedIn. Just search Kristen Sweeney. And if you'd like more insights on communication and content, subscribe to our newsletter using the link in the show description. Thanks for listening. Talk soon.